It is just a huge honor to be sitting here in Sydney, Australia, with a mentor and role model and idol of mine, Rachel Hall.
Lovely to meet you.
I've been a big fan of you on Twitter.
Yes,
for years.
We've had some nice chats and backs and forwards.
Yeah, and I've retweeted a lot of your stuff.
Thank you, I do appreciate it.
Big fan of yours. So Rachel Hall graduated from Leeds University in 1992 and worked as a NHS dentist. That's National Health Service in England, right? In the UK for 8 years, where she honed her skills to be very time efficient and productive. Suffering from boredom, burnout, and the cold weather, Rachel moved to Australia in 2000 and in 2005 opened her own holistic dental office called Evolve Dental Healing. Rachel provides safe amalgam removal, mercury-free dentistry, and has a special interest in dental sleep medicine, TMJ, and sleep apnea. Rachel is also a practitioner of Universal Medicine Therapies and likes to meditate and take care of her health and well-being. During her time in business, Rachel has developed her skills as a dentist and a businesswoman and invested in coaches to support her growth and success. Now at age 48, Rachel has decided it's time to give back by becoming a business and life coach for dentists, establishing Ascendancy Business Coaching for dentists, where she teaches dentists the processes and skills to master the ABCs of business for dental office. Her coaching services, systems, and insights into what it takes to make you and your dental office a success so you can live the life you want are highly sought after. Rachel has won the Pro Trade Business Innovation Award 2016 and was nominated for Business of the Year 2016. This year sees her being nominated for the Outstanding Workplace and the Business of the Year 2017 awards, which will be announced after this recording. Rachel is a social media fanatic and a passionate industry leader who is a respected writer, presenter, and speaker on the subjects of holistic dentistry and natural health. She is also a mother, dog lover, an author, as well as a driller of teeth. Dr. Rachel is a self-confessed nerd and loves technology and is big on healthy lifestyle and well-being. The reason I wanted to get you on the show so fast is because in America, when you talk to dentists, if you say holistic, they're just like, oh my God, quackery, nuts, crazy. But then when you watch the dentists, they're all holistic. Like,
exactly.
if you talk to a dentist and his doctor says, okay, I need to put you on a statin and I need to put you on some high blood pressure medication, the dentist won't do it. He'll say, okay, enough's enough. I need to lose some weight, start exercising, join a gym. I look at dentists, they always talk about how they feel sorry for their patients because they're on 5, 6, they call it polypharmacia, they're on 5 different medications. So the dentists are extremely holistic in nature, yet they think that term is bad.
Means that we're woo-woo and we're out there, but for me it's about taking oral systemic health to a next level. So we all understand that if someone's got gum disease, that's going to increase risk for heart attack, strokes, diabetes, cancers. There was even stuff in the press this week that if you're a menopausal woman, you're much more likely to get several different types of cancer if you've got untreated gum disease. So we know that we're doing that, but we've got to go beyond brush, floss, don't eat sugar. We've got to help our patients to make those lifestyle changes and to make sure that they understand that they've got a really big role and responsibility to play in their own health and well-being. And I think we as dentists have a great opportunity when we're looking inside somebody's mouth to pick up signs of inflammation and systemic disease.
Yeah, it's definitely the future, isn't it?
Yeah.
Yeah, and it seems to be that 30 years ago this technology would come out slow, like maybe every 5 years, but now it just seems like there's just research coming out faster than you can read it.
Every day you open up, the thing with Google is you can do a search and there's just papers after papers after papers on this. And I think as dentists, if we're not keeping on top of that, then we're doing a disservice to our patients.
Now, I would think, especially in America and Australia, Australia's a very conservative country.
It is, yes.
I mean, it reminds me a lot of the United States and conservative. What percent of dentists in Australia put on their website that they're holistic?
Oh, it's tiny.
Yeah.
It's got to be probably not even 1%. Look, I work in Brisbane. There are 6 holistic dentists in that whole city.
And do you see it as a marketing advantage? I mean,
it's a huge marketing advantage for us because times are tough since the GFC. Dentistry,
What's the JFC?
The global financial crisis.
Okay.
Dentists are struggling.
I never heard it called GFC.
Australians,
The 2008?
Yeah, Australians will abbreviate everything given a chance.
So that was a gift from America. Did you send us a thank you card for that?
We did. We've got an oversupply of dentists. New graduates are finding it hard to get work. We've got a lot of overseas dentists coming in to get qualified here in this country. So having a niche allows you to target a market, as you know. But most dental practices would find their patients will only travel about 10 miles at the maximum to come and get treatment done. I get patients come from all over Australia and overseas for treatment because of the holistic work that we do. Because people have a philosophy about their life where they want to live well, they want to take charge of what they're eating, what products they're using, they're organic, healthy living, clean eating, etc. And they want their dentist to have the same approach. Yeah,
I mean, and there's other approaches. I know a dentist in San Francisco that just took his office off the grid. And he advertised that he's an eco-friendly dental office off the grid.
Yeah.
He has people coming from the other side of San Francisco 1 hour just to come to his office because they want to reward somebody who shares their same values of not leaving a carbon footprint.
And I think that there are many opportunities for us to tap into that. And as dentists, we've got to be savvy, we've got to differentiate ourselves, and we've got to position ourselves in a way that, you know, if there's 20 dentists in your suburb, someone's going to look online, who they're going to pick? If you've all got similar reviews, who they're going to pick? They're just going to go random, pick, call the phone. If your receptionist is nice, they'll probably book with you. But if you've got something that speaks to them and says, I understand you as a human being, they're in. They trust you and they want what you offer even before you've said hello and examined them.
And the research is clear that the consumer has no idea what all the alphabet soup behind your name means.
No,
it could be A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P. They don't know what any of that means.
No, they don't care either. As far as they're concerned, you're a dentist, you drill teeth. Their things are, how much is it going to cost me? Are you going to hurt me? And are you going to be nice to me? Yeah,
so holistic and environmental are huge. I know your city is wrestling with building the largest coal mine in the world.
Yeah.
And the environmental people are like, no, that's not the way to go.
Yeah,
build the biggest solar farm in the world.
Yes, absolutely.
And so what do you think will win? Do you think the coal mine will win?
I think the coal mine will win, unfortunately, because it's going to generate more jobs and more resources and infrastructure.
So explain, you're talking to dentists from Kansas to Kathmandu. What does it mean to you when you say you're a holistic dentist? What does that actually mean?
Well, it's a way of looking at a patient as a whole being and not just a tooth. So if I'm seeing someone who's got gum disease or tooth decay, gross wear on their teeth, they're constantly fracturing fillings, I want to know why. I want to get to the underneath cause of that. So have they got some health condition? Is their diet really poor? Are they not sleeping well? Have they got a sleep breathing disorder? What are their stress levels like? What's their health like? Have they been exposed to toxins? And is there something that we can do as a dentist to then support them either to get healthier or to prevent them from getting worse?
And you, so you've got 2 websites. One is your dental office is evolvedental.com.au.
Yes.
And then you started your Ascendancy Business Coaching at ascendancybusinesscoaching.com.
Yep.
So if my homies went to ascendancybusinesscoaching.com, what would they find there?
Well, at the moment, they find quite a small website that's starting to grow. But it's about my journey as a dentist. This is my 25th year. The first 8 years, I just was thrown in at the deep end, get on with it. You make your mistakes.
That was in England?
Yeah, you make your mistakes and you learn that. Then I moved over to Australia and I worked for a really lovely practice, but they had no business acumen. I'm like, gee, if this is how you run an office, then I don't want a bar of it. But they got divorced, so I opened my own place. And the first 5 years of being in business, I was making it up as I went along. So I was learning the school of hard knocks, heartache, headache, and picking yourself back up and going again. Then I realised that my answer, what I was raised with, Howard, was if you want to do well, you've got to work hard. So my mindset was, I've just got to work harder. I've got to work harder. I've got to work harder, and eventually I'll be successful. I might be able to take some time off, spend time with my family. But obviously that was just wearing me out. I was burning out. And I thought, no, this has got to change. So I employed a business coach. We systemised the whole practice. We looked at finances, marketing, HR, all the avenues that you need to have. And I took the business quite a long way with that. And then I went, you know what? I need more. There's more potential here. And so I got a business consultant in dentistry who was a dentist himself. And he then helped me hone systems and protocols and things within the practice so that we could offset some of my workload and actually double my income. And that was 5 years ago. I thought, well, if I knew 10 or 15 years ago what I know now, I would have paid millions of dollars for that information, because that's what it's been worth to me. So part of me wants to help other dentists not make all the mistakes I made, fast track their business so that they can actually make some money and not get to the end of the month and they're constantly living off their overdraft, and also to help them manage stress, anxiety, and all the things that come with dentistry. It's a hard profession and it can be quite lonely. And so I want to be someone who can be there in their corner for them.
Yeah, I don't think they've figured it out yet, but you know, I remember when I was working in my dad's restaurant. Well, everybody's happy when they come into a restaurant. They're going to eat food.
Yeah, they're there for a good time.
But when you're in dentistry, where you're really close to someone, you're touching them doing surgery, and they're stressed, and they're grabbing the chair.
And all that's coming off them, that vibe.
And it affects you.
It does. It affects you when, I mean, I don't know how many times I've heard this, but, you know, a new patient, someone who doesn't know me, will walk into the room, first thing they say to me is, I hate you. And I'm like, gee, that hurts. But we have to laugh it off and pretend it's okay. But can you imagine if you were a young child and every day you got up and your parents said to you, I hate you? What that does to your psyche?
That's why Ryan's dead inside.
Yeah, exactly.
I know.
I'd heard that story. I'm going to have to watch you. But we're human beings. But because we're behind the dental chair, that gets forgotten. And then our team don't get what we go through. We're having to manage them. They're like having another family. You have to deal with all their issues and ups and downs and personalities. And at the end of the day, there's no one for you to turn around to and offload and get some support. And you go home to your partner and they kind of get what you go through, but they're like, yeah, you told me that yesterday. And so you tend to just keep those things to yourself. And to me, that's really unhealthy.
You know, when we were in school, they told us that 90% of all TMD patients were women. And so a lot of the researchers started looking at, is it estrogen, is it this or that? And then it took them 25 years of epidemiology to figure out that men and women have the same incidence. It's just that women will go get help. Up.
Yes.
And now it seems like any consultants I talk to in America, they say that as far as millennials, the women dentists are the first ones to raise their hand and get a business consultant. And for something about the guys, you know, they... I remember my mom and dad... Well,
you won't even stop and ask for directions.
I know.
Come on.
I know, they won't ask for directions. It's big ego.
Yeah.
And they're a doctor. They're the smartest one in the room. So how the hell could someone else know more than me when I know everything on earth? And it's sad because I see so many miserable male dentists, and they keep trying to solve their problems with technology.
Yeah.
Chairside milling.
They buy more stuff.
They
do more CE. And they think that's the answer. And
is it the answer?
It's not. All you're doing is you're buying bright, shiny things that are increasing your loans. You've got to work smart. We weren't taught business. I don't know about in America. I bet you don't. No, we get nothing. We weren't even taught how to speak to someone and explain a treatment plan, you know, in plain, simple language. So you got them telling you hate them. You know, I hate you. I hate coming to the dentist. All that anxiety. Then you're presenting treatment and you're getting rejected over and over. That for a man's terrible. I know for women it's about self-worth, you know, so you've got to feel valued. And I think men fear rejection more than women. So every time your patient says no, that's another knock on your psyche. So you go, I'm going to get better educated, I'm going to get more letters after my name, I'm going to get more fancy equipment. That's going to make me a better dentist and it's going to make me more money. No, it doesn't. you've got to be able to communicate, you've got to be able to understand marketing, you've got to be able to understand finances and how to get your team behind you so that you can leverage them so they're doing more work for you so you can then be a better dentist.
Well, if you lined up 100 dentists and you said, what keeps you up at night the most? What puts that pit in your stomach? What makes you not want to go to work? 99 times out of 100, it's the staff.
Yeah.
When you ask the consultants in America, when you go into an office, what usually is the number one problem? They say, well, it's always the staff. Why is that so hard for?
I don't know, but I was just going to make a comment on that, is that the dentist moans about the staff and the staff moan about the dentist. So there's a common denominator going on here, that there's this sort of isolation of the boss against the team. I think what's going on there is that, I don't know, for me, I was never like a team player. I liked individual sport. I liked to be doing things on my own. I like to be in charge. I like to lead and like to do things my way. So then asking for help and support is quite difficult. But when we were at dental school, you didn't ever have an assistant helping you on clinic. You were suctioning yourself or getting your patient to doing it. So you're used to trying to do it all on your own. So there's two things I see there. Ego, where it's nobody can do it better than I can, which is bullshit, pardon my language. And we have to let go of that and trust that we've got strengths and weaknesses. The other is a trust issue. We don't trust people. We think they're going to let us down. They've let us down before. They're going to make mistakes. Then I've got to pick it all up. So there's those two things going on mentally. There's also a time issue. I want to be sat when I'm at work. I want to be with patients, drilling teeth, making money. If I've got to stop and train my team 2 or 3 hours every week, I'm not making an income, and why should I bother? Because they're going to leave anyway, or they're going to let me down. But if we don't train our people to do what we want to do, then we're expecting them to be mind readers. Could you imagine McDonald's with no systems? You know, everyone knows if you work at McDonald's, you've got to ask, do you want fries with that? But in dentistry, it's a free-for-all. The only person I as a dentist can watch is my DA. My assistant who's sitting next to me while I'm working, I can listen to every word and watch every movement she does. But I've got to trust that my ladies out on the front desk who are booking patients in, hopefully taking their money, answering the phone, I've got to trust that they're doing what I want. But if I don't tell them what that is and what it looks like, train them, and then check in with them, how do I know? And so if I don't tell them, I'm going to bitch and moan about them because they're not doing what I want. I'm going to be stressed that they're not doing what I want. But the team then are upset because all they hear from me is me telling them off, but they're like, but we don't know what to do. You haven't shown us. So we've got to invest in our team.
Yeah, well, you know, you go get a job at Subway, and those 16-year-old kids have to, before their day one, they have to get on the Subway site, take 8 one-hour courses, and answer the questions afterwards. But if you train that kid to go work at your front desk, he would just show up and you'd throw him on his desk.
Go, there's the phone, there's the appointment book him in.
Yeah.
And I don't know, often what happens here, and same in the UK, is you'll have a dental nurse who's a little bit more extroverted, and she gets put on the phone. But she doesn't want to be on the phone. She wants to be sat helping you and working with patients. That's why she went into dental nursing. So now you've got someone in a role that they don't like and they're not suited for. So you can spend tons of money on advertising. You may have 100 new patients ringing every month, which would be phenomenal, but you're only converting 10 calls because you've got the wrong person out on the desk or they haven't been given the skills.
Yeah, it's crazy. You know, when I started coming down here in the 90s, the average dentist, if you said, well, what is your main problem? They said, well, when someone has an emergency because I don't have any openings for 2 or 3 months. And so that was 1990. Now fast forward to 2017. You let in 1,000 foreign dentists. You doubled your number of dental schools. You have corporate dentistry.
Yep.
You have medical insurance companies like Bupa buying dental offices. Yep. It's massively competitive now.
It is hugely competitive. And look, these days, you know, you're lucky if you're 80% full. If you've got an 80% full appointment book, you are doing really well. times are tough. So we've now got to start thinking more like business people and going, what are the opportunities available to us? In the 60s, I think it was something like 78% of dentistry was restorative work. Now it's only 40%. People are keeping their teeth longer and they're keeping their teeth healthier. But those people who are having all those fillings in the 60s are still alive, and those fillings are failing. So we've got a whole ageing population that are going to need to be spending money on dentistry. One of the biggest mistakes I see with my dental clients is they underprescribe treatment. They are scared of telling a new patient, you have all these cracked teeth and broken down fillings. So they'll tell them, oh, I'll patch repair these and I'll maybe offer 1 crown in the hope that they say yes. And so not only are we struggling because there's more competition in the market, but we're shooting ourselves in the feet because we've had so much rejection when we put a big case forward that we're no longer even willing to say honestly to a patient, hey, you've had a lot of dentistry done, your teeth are heavily filled, it's starting to fail, we need to make a proper plan so that when you're 70, you're not spending $50,000 on getting your teeth fixed.
What % of Australians in their lifetime do you think will buy a new car?
Oh, 80%.
Yeah.
Easily.
Same as America. And the average price of a new selling car in America is $30,000. And 80% of Americans in their lifetime will buy 1 or 2 or 3 of these new Honda Accords,
Yep.
Ford Taurus, whatever. Yet only 5% of dentists have ever even sold one treatment plan one time for the price of an average new car, $30,000.
Yeah.
And what's amazing is you go into a medical dental building, there'll be like 8 dentists in there. And 7 dentists are doing 1 tooth dentistry. And then this guy over here does a full mouth, once or twice a month.
Yep.
So there is a lot of self-limiting beliefs.
Absolutely. Yep. And I will say, look, if I was a heart specialist and you came into me and your arteries are 70% blocked, am I going to not tell you? Am I going to just go, oh, I better not tell Howard he's got some problems with his heart because he's not going to like me and he's going to go somewhere else and he's going to tell his friends that I'm a really horrible consultant and it's going to damage my business. So I tell you what, I'll be really nice to Howard and I'll tell him everything's fine, but I'm just going to watch a couple of things for him. No, I've got a duty of care to say to you, Howard, I'm really bloody concerned here. Your arteries are blocking and I think you're going to die soon if we don't do something. So why is it in a subdivision of medicine called dentistry that we're not upfront with our patients? Why are we always waiting for them to have an accident, an emergency situation before we're willing to do any treatment? We should be being proactive and preventing problems. I would rather someone go out of my office and not like me because I've told them the truth than halfway through our relationship I suddenly drop on them that they now need 6 crowns when I told them 6 months ago everything was fine. Who are they going, where's the trust factor in that?
So what is your program like? If they went to Ascendancy, ASCENDANCY, ascendancybusinesscoaching.com, what do you do? Do you go to the office? Do you do it online?
So we work one-on-one. We do calls through the month. So we usually have 2 calls each month where we'll talk about what the challenges are, what the goals are, what we're aiming towards. I would also do some training within that with that dentist. So if they're struggling on case presenting or treatment planning, then we'll help with that. As the program goes on, I'll give them some marketing materials, I'll give them some worksheets to do so we can look at their mindset and their beliefs. And then they can do a VIP day with me. So if they're here in Australia, they can either come visit my practice and see how we work and how those things that we talk about actually run through the day, because my team does so much for me that basically my day is saying, hey, how are you? This is what we're doing, blah, 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 drill away, we're all finished. That's my role. The team take care of pretty much everything else, most of the day-to-day running, and I want to teach dentists to do that. So if they're not in this country, we can do like a half-day VIP intensive training via Skype, and so that can be on social media or whatever it is they want to do, and they have that 4 or 5 hours just picking my brains, and or we can show them behind the scenes in the practice. So we've got a few programs, and we like to be flexible because I think it needs to be a custom-made process. Not everybody's facing the same challenge or has the same sort of personality and belief systems that need to be overcome.
So how has your success been with the dentist?
It's been really good. Look, it's in its infancy, so it's growing. But the dentists I've been working with have grown in self-esteem and confidence. They're seeing increased productivity, better case acceptance. And in one of the businesses, they had 5 team players, 3 left. 2 really stepped up and have started, commanding the practice and really helping the dentist. And they've got 3 new girls in who have got great attitudes. And he's starting a training program with them. So every time he trains them, they video it. So this was off my advice. This is what we do on it in our practice, is every time we train, we videoed it or audio recorded it. So they've now got a library like we have where when you onboard a new team player, just like Subway, they can go online and they can watch those videos and take a quiz.
What percent of the dentists, when you start working with them, have a staff member that needs to go?
All of them.
Yeah.
And they probably have more than one staff member that needs to go. And there's things that I see there is that either the dentist is very blinkered and they don't realise they've got a cancerous team member or a toxic team member, or they know they have, but they're so scared of firing them because that person knows how to do everything in their business. And if they leave, nothing's written down. Nobody knows how to do it. So they're absolutely pooping their pants that if that person goes, their business is going to collapse.
Yeah, I mean, I always think it's amazing. I mean, sometimes I'll be at a seminar and, you're just talking to like a dental assistant at the break and everything. I say, oh, which one's your doctor? And I say, that guy over there. And I'll say, so how do you like working for that guy? And she's like,
yeah.
It's like, wow, you don't even know me, and you just rolled your eyes at that dentist there. I mean, how does that work when the dentist leaves the room?
Yeah.
And the patient turns to you and asks, I mean, it's just like, okay, I don't even know that doctor, and I've already determined in 1/2 of a millisecond that he's got a toxic, cancerous dental assistant.
Yeah.
How do I know that? I can't even pick the doc out of a police lineup.
Yeah.
So how do they miss that?
I think there's 2 things there. One, they don't want to see it because it's hard hiring staff and onboarding them and getting them there. The other is that people can be very manipulative. So they can tell you all the right things to your face and they can put on the happy smile and they can look like they're performing the role. But behind the scenes or in their head, they're thinking that guy's an idiot.
So when my set tells me that I look like Brad Pitt, it might not be true. They might be. They might be fibbing.
Yeah.
So how do you fix the funnel into the leaking bucket? So when I look at the research on the funnel, 10 people have to land on your website before it converts 1 to call.
Yeah.
3 people have to call your front desk lady before she gets 1 to come in. 3 people have to come in with just a cavity before 1 gets drill, fill, and bill. So to do that, so when the average American is collecting $750 in revenue and taking home $180,000 a year, and to do that $180,000 a year for that 1 filling, 3 had to come in. For 3 to come in, 9 had to call. For 9 to call, 90 had to leave on the website. So you have this whole funnel, and then when you have this practice, it's a leaky bucket because by the time the average American gets to 5,000 charts, 4,000 of them have never came back.
Yeah, it's true.
So if you just fix any of that funnel or plugged any of those leaks, you could double your practice.
Absolutely correct. And it's which part of that funnel you should focus on. So is it customer service and making sure you're giving a wow experience and, that they're coming back because you care about them as a human being and you're doing something that's a bit out of the ordinary to another dental practice? Is it being out there more with your marketing and trying to break the mold a little bit? I mean, we were talking about this before we started the show, was that we have so much technology now at our fingertips that we can become our own movie stars. We can get YouTube channels, we can be on Facebook and Twitter, we can be out there. And now with Facebook and Facebook Live and the way they're promoting that and getting that out to millions of people, you've got such an opportunity. And what happens is, it's something like 7 to 14 touch points before someone will buy with you, is what they reckon in psychology. So if you can be out there on a live video just showing who you are and a bit of your culture, showing that you're a human being and that there's something about you that person goes, I like them, that is half the battle, so that when they do pick up the phone, they already want to come in. But you've got to have that front desk person trained so that they're saying the right things and they're giving them the same experience that they got watching you on social media. But then once you get them into practice, you've got to match up to their expectations. So you can't come across on social media as being, oh, I'm awesome and I'm funny and I'm this and I'm that, if that's not who you are at work. You've got to be authentic and genuine. There are so many marketing agencies out there at the moment, and they're going to promise you, oh, we can do Google AdWords, we can get your front page on Google, blah, blah, blah. Yeah, anyone can do that. It's just mixing algorithms and what have you. I think the key is you've got to give great customer service, and then you've got to ask for reviews. Now, here in Australia, we've got one arm tied behind our back with that. It is not legal for us to ask directly for a review. Like, I could not email you and say, hey, Howard, we had a great appointment. Could you just go on Google and tell everyone how awesome we are? I'm not allowed to do that. We're also not allowed to have testimonials on our web pages. Because,
really?
Yep.
No patient testimonials?
No patient testimonials, because our legal governing body says that that's kind of trying to make out that one dentist is better than the other. And I'm like, come on, let's get real. Dentists are better than each other. I am an average dentist, and I will be very honest about that, but I'm not average in the way I treat people, in the way I communicate with them, the way I want to know them, the way I care for them, the way I make them feel. So when they leave us, they've had a great experience and they've had good dentistry. It's not bad dentistry, but I wouldn't put myself up there with, oh, look at my awesome crown margins, even though I do good dentistry. But they don't care about that. They care about how you made them feel. So if you can get good, genuine reviews, that's going to make a big difference to your funnel. Now, we're lucky. Both here in America, we've got options where we've got third parties that we can utilise to obtain those reviews and review processes for us. But if I go online and I'm looking at a hotel, for example, I'm going to look where it is, because that's my first thing I need to know, is it convenient for me to get to, and is it going to be near all the attractions? The next thing I look at is the reviews. And if it's got poor reviews or no reviews, I don't trust it and I'm not going there. So if there's 20 dentists in your area and you've got no reviews, they're not even going to look at you. They're not going to pick up the phone. The other thing that you talked about is that you've got to have a website. How many dentists don't have a website?
Oh, yeah.
You do not exist in this day and age if you don't have a website or a social media presence. Your DNA does not count for anything. You have to be online. You've got to have a website. It's got to be user-friendly so that you can use it both on a laptop or on a mobile. It doesn't take much to get that set up. And then don't be vanilla. Don't say the same things everybody else does. Don't be all me, me, me. I'm this and I'm that and I've got this degree and I've been on this CE. Boring. What's in it for the patient? How can you help them? That's what I want to know if I'm reading your website. What can you do for me? I'm scared or anxious or whatever. Are you gentle, kind, caring? Everyone says they do that. But there has to be something within us that, yes, we're all dentists, but we're all people, so we have a different personality, and that needs to come through on the website. So if you don't have a website, you've got to get one. And
yeah, I love your website.
Thank you.
And I also like, there's a lot of noise in the industry. I've always said, being in dentist 30 years, if I told you you needed dental work done, half of you are afraid of the pain, the shot, the drilling, can you knock me out, give me laughing gas. The other half are afraid of the cost.
Exactly.
But the industry makes them think that what consumers want the most is same-day dentistry. And do you hear that all the time?
I hear it all the time. And look,
but do you think that's true?
I don't think it is true.
And on your website, the first thing you talk about, are you afraid of the dentist?
Yeah.
Not, are you looking for same-day dentistry?
Yeah.
Are you looking for a dentist with a laser?
Why?
I love
because
that.
I'm a dentist. Hi, I'm Dr. Rachel Hall, of evolved
My hair's longer there.
I love that.
Thank you.
Because I
But straight away, that's the point of difference. You're not expecting that. And we didn't do it with a corny, if we market it this way. I'm like, we had the opportunity to do a video, and I'm like, how can we have a bit of fun with this? How can I get across who I am? And the scare mask, the scream mask, and that sort of was like a bit of an off-the-cuff,
that was awesome.
bit of a joke. And I went, you know what, we should run with that.
But how many people are afraid of the dentistry versus what percent want it same day chairside milling?
Look, they don't. They don't
What would
want
you say? It's 100 to 1?
easily.
Yeah.
And if someone's actually anxious, most of the times they don't want it done there and then. They want to build a relationship with you. They want to see what you're like. They want to see how you speak to them, how you relate to them. Do you understand their fear? And then when you're examining them, are you gentle? Are you considerate of them? Are you explaining what you're doing and what's about to happen and what they're going to expect? If you can do that at your new patient exam, then they know when they come for their next appointment that foundation has been set. I think for a lot of scared patients, they need time to get their mind around what's going to happen and to psych themselves up for it. Look, there's going to be a small percentage that will be, look, I'm here now. It's took me all this effort to get here. Can we just get on with it? But that is a very small percentage.
So, Rachel, in America, I don't know how it is in Sydney, but in America, 91% of all healthcare appointments are made by women.
Yes,
whether it's a
same
hospital
in this country.
or an office. If a woman is at home and her air conditioner breaks down and she calls the AC repairman, he says, Rachel, I can't fix this. You need a whole new air conditioner. 100% of American women would be thinking, I wonder if you're just trying to sell me a new air conditioner. I wonder if my Uncle Eddie was an AC repairman. He'd fix it with duct tape and a shot of Freon. They get a coupon. Take this and go get your oil change for $20. And every time the man comes out and says, well, I think we should also change your transmission fluid and air. And the women never believe it.
Yeah.
So then I come into your office and I have no problems. I want to get my teeth cleaned. And you tell me I need 4 cavities. And they're $250 each. And every woman in America is thinking, $1,000. I don't have any problems. I just want to get my teeth cleaned. The only question I had is maybe bleach me. How do you sell the invisible? How do you project trust to where I really believe you that I have 4 cavities and you're not trying to get $1,000 out of my wallet?
And that's a great thing because trust is not something you can magic out of thin air. I mean, it's the way you are with people, it's your body language, it's your communication, the words that you use. However, when I first started dentistry, we didn't have intraoral cameras. We had wet x-ray films, tiny little things that you're trying to hold up in front of the patient on a monitor and go, you see that? That's a hole. We have far, far greater opportunities now. We can photograph a tooth. We can get a digital x-ray and we can blow it up really big. So we can show them physically before their very eyes that there's something going on. So that's a really big help. The other is helping them understand that dental disease is a chronic disease process. So like a heart attack, you don't know you're going to have one until you either drop down with it or it's picked up in a screening. And that's why we do dental checks, is so we can pick things up. So I can say, what I say to them is, I think if you've got any element of desperation, like I need to get this appointment booked, I have to have that money coming in, people smell that. And they smell that fear factor as well. And that's what they start to go, hang on, something doesn't feel right. I'm a bit nonchalant. I don't care whether they get the treatment done or not. It's their mouth. So I'll say to them, you've got 4 areas of decay. We can treat that now while it's small and it's easy to deal with. Or if you want, you can leave it. It's going to get bigger. It's going to get close to your nerve and you're probably going to end up needing root canal and a crown and it's going to cost you $6,000 instead of $250. What would you like me to do? And I put it back on them and I make them take responsibility and ownership because they're the ones who are looking after the mouth or not, and they're the one who's got to make the decision. And I think the fact that they can sense that I don't care either way whether they have their dental work done with me or not, somehow kind of flips the psychology where they're like, oh, it's my decision. And that for us changed our case acceptance dramatically. Whereas when I was trying to be, you have to have this done, you need to have some feelings, oh my gosh, you've got decay, we've got to get you booked in, there was no what's in it for them. And they felt railroaded, but I didn't know any other way, Howard, because no one's taught you. You just basically, I mean, this is terrible. I mean, you used to do their exam and you'd be telling them why you've got your fingers in their mouth. Oh, you've got a hole here, you need to come back for a filling. None of this stop and sit them up and have a conversation and show them and talk to them and ask them what their thoughts are. But I think if you engage them and ask them, well, what do you think? Does that make sense? What do you want to do? Are you wanting to keep that tooth? Are you willing to risk that it's going to get worse? And let them answer. I think that makes a big difference on the trust level.
I always tell the dentists in dental school, I said, if I can wave a magic wand and give you one gift in dentistry, it'd be that you had a superior chairside manner. It's more important than anything else.
Biggest mistakes are they take too long. So they speak for 20, 30 minutes. Sleep, checked out, disinterested, confused. They give them too many choices. Oh, you can have this. Which one do you want? Excuse me, who's got the degree? Who's the one looking in the mouth and having an understanding of what's going on and actually what's needed? Too many choices confuses them. You think you're being fair, but you're actually making it hard for them. And they're sitting there going, well, you're the one in the white coat, you tell me. So that is a bit odd. And the other thing that I see, and this is a huge mistake, is teaching dentistry 101. So I say, you need a root canal. Well, what we're going to do is we're going to drill an access hole, we'll have a rubber dam on, we're going to have it isolated, I'm going to use these little reamers, I'm going to have them in this machine, I've got an apex locator, I've got to debride it all, I've got to disinfect it, then I've got blah blah, and they're like, what? They just want to know, how much is it going to cost, how long is it going to take, and is it going to hurt me? So if we can keep it simple, that goes a long, long way. But you've also got to then allow that person to have a discussion, answer questions for them, make them feel heard and understood. We'll go back to cars. If I'm in the car showroom, you've also got to get behind what their motivation is, what I call their reason to return. So if I'm going to buy a car and the dude in there goes, oh, well, she's a mother, I'm going to talk about safety features. I ain't buying that car, Howard. I don't give a damn about safety features. You know what I want to know? How fast does that car go? If that's what they work out I want, and they'll say to me, oh, it's 0 to 60 in this amount of seconds, it's blah, I'm going to go, let's get in the car, let's take it for a test drive, and if it's as fast as that, I'm buying it. So we've got to also get in their mind. Why are you here? What's important to you? What's your motivation? I just want to clean. Okay, I can see that you do need a clean, but do you want me to tell you that there's actually some other things going on here? Or do you want me to just ignore that you've got dental disease? So you start having a dialogue.
You mentioned something. You said, you're asking your patient what they want to do, and you said you're the one in the white coat. On Dental Town, a lot of people, especially when they get out of school, they're like, the guys are saying, what is more trusting and authority? Should I wear a 3-piece suit and a white lab coat over it, or can I just wear scrubs? A lot of the girls are saying, should I walk in there in a dress and high heels with a white lab coat, or can I wear scrubs? It seems to be a big question.
Yeah.
The infection control is scrubs and tennis shoes, but do you need to be in a dress and a tie and a suit and tie?
I think it depends on your practice. Scrubs to me look scruffy. They also don't convey an air of professionalism. If a whole team wears scrubs and the doctor's wearing scrubs too, who's the doctor here? We have a very corporate image in our practice. We want to be high-end, we want to look smart. So our team, we say to them, we want you to look like their hostesses. We want you to be very well turned out. We want you to look really smart. And I think for me as the dentist, that's important too. So I wear a nice tailored blouse, some dress pants, black shoes. I don't like heels because I just can't walk or do dentistry in them. But I think it comes down to what you're trying to market your brand as. What are you coming across as? And to me, someone who looks like they've got a pair of pyjamas on, whilst that might work on a program like ER, that for me doesn't cut it in a dental office. If I'm trying to sell a $30,000, $40,000 treatment plan, I do not want to look like I'm wearing a pair of pyjamas. I want to look smart and as though I carry that air of authority. So I would be recommending that it's a white jacket over the top of a nice dress suit.
And then another question is, who presents a $30,000-$40,000 treatment? Do you do
Very
that?
good question. I used to, and my case conversion was appalling. Because as soon as it got to the money conversation, I'd be going, oh my God, this is so much money. How can I would be freaking out. But also, the patient sees it as, when you tell them that figure, in their mind, they think all that money is going in your pocket. They don't understand you've got overhead and wages and equipment and loans to pay for. When you say $30,000 to them, they go, well, that's their new car or their holidays or their kids' private education. They're not seeing it as a business. So I actually don't think as a dentist it does us any benefit to actually present the case. I think we should be presenting what's needed. And yes, we do to some degree need to touch upon money. So the way I handle that is I'll say to them, you need 12 fillings. You know, you've got 12 areas of decay, you need 12 fillings. If we ballpark that a filling is $300, you're going to be there or thereabouts. They can then do a bit of the maths in their head themselves. They're smart enough. For me, I have a treatment coordinator and it's her role to present the cases and to actually break down, this is what the appointments are going to cost. This takes a step back because they don't see my front desk, my receptionist, as having a vested interest in getting that $30,000 because it's not going in her pocket. She's more on their side. So as that independent, she can be talking to them about, oh, I had a filling done and da-da-da, or I didn't get some work done and I ended up getting a root canal and now I've got a crown and I really regret it. And it takes that charge off it being a deal that we're trying to strike with them. So I personally think from trial and error and for what we've done in our practice is that it should be your treatment coordinator, but she's got to be trained and she's got to be sales oriented. So our treatment coordinator has a retail background, so she understands how to sell benefits and how to talk to people about money without her having any qualm with saying a figure. She will say exactly the same whether it's $500 or $50,000. Her demeanour does not change.
And what percent, first of all, how many dentists do you think are in Australia?
At last reckoning, it was around 20,000, I believe.
20,000? And what percent of them have a hygienist doing all the cleanings?
Not many.
What percent would you guess?
Well, I've worked in 4 practices over here and I only had one practice that had a hygienist. And when I had my own business, I didn't have one for 8 years.
So what would your advice be? Do you think...
Get one.
Get one?
78 to 80% of dental treatment now is preventive. So I worked it out with my dental consultant when I didn't have a hygienist, what percentage of time I was spent cleaning teeth. And it added up to 1 week every month that I was cleaning teeth. And I'm like, okay, well, if I could free up 1 week of my book to do high production, what sort of revenue is that going to create for me? Plus my hygiene department are doing impressions for whitening, for night guards, they're doing preventive care, they're doing periodontal gum therapy, and they're spending far more time with the patient than I could have ever done when I was trying to do it all myself. So that patient's building a better relationship with the practice and they're getting proper treatment. They're not just getting a tickle over with an ultrasonic scaler, they're actually getting their disease treated, which, going back full circle to oral systemic health and being holistic, is the key to our business. We're all about, we do not want inflammation and bleeding in our patients' mouths because that is setting them up for ill health.
Yeah, because bleeding gums, the surface area of the gums is the same size as your palm.
Yes.
And if someone was walking around and their palm was just oozing and bleeding, they'd go to the doctor.
They sure would.
But they walk around with that with their mouth.
Yeah, and they think it's normal to spit out blood.
I want to ask you some controversial questions.
Yeah, go away. I knew you would. We've had our stashes on Twitter occasionally. A bit of fun.
The we know after AIDS
Yes.
that humans in a herd transmit diseases sexually. And I think AIDS burned that into every country's psyche.
Yes.
But you still go into dental offices, and they've been treating grandma every 3 months for periodontal disease for 10 years, and they've never seen grandpa.
Yep.
And then grandpa shows up with a broken tooth, and he's got bombed out teeth, he's got periodontal disease,
Yeah.
and grandma kisses him every night. And they say a kiss transmits 80 million, the standard kiss, 80 million microorganisms, fungi, viruses, and parasites. A lot of dentists say, well, I'm sorry, it's not like hepatitis or AIDS or HPV. It's not a communicable disease.
It is.
Do you buy that or not?
I believe it is a communicable disease, and that if you've got someone coming in and they're coming every 3 months for periodontal maintenance and they've still got active disease, they've either got some systemic health issues and nutritional deficiencies that need addressing, or their partner needs to come in and get their mouth sorted out. And we'll say to them, does your husband go and have regular hygiene treatments? Have they got issues with their gums? And we'll say to them, because every time you're intimate, he kisses you, he's reinfecting you, he's inoculating you with bacteria, and that's why we can't get your condition under control.
The only if someone said to me, lecturing around the world, which dentists are the best around the world? I have to say it's Liechtenstein and Austria. Those are the ones where they actually, the only 2 countries I've been to, where they actually, if you come in pregnant, they say, who is going to babysit, who's going to be in the same home?
Who's going to be kissing this baby?
And if it's you and your husband and grandma's going to sit or whatever, they want saliva test on all of them. And then they'll sit there and say, because they really believe in loneliness, they say, okay, this baby's not going to be born with HPV, Streptococcus mutans, P. gingivalis. She's not going to be born with, just like she's not going to be born pregnant with AIDS and gonorrhea and syphilis. She's going to be a blank slate. And they'll test them, and they'll get everybody's mouth in condition. And then they will coach the family of saying, we're not going to kiss the baby on the mouth.
Yeah.
And you're not going to
blow on their food and lick their spoon and lick their dummy.
Yeah, and I mean, you see in family situations where, your Uncle Eddie is 70 and wears 2 partials and hasn't had his teeth cleaned in 20 years, and he'll pick up the baby and kiss it right on the mouth. And they start coaching these things. But what's interesting is they do testing for Streptococcus mutans, and I've only heard dentists say this in Austria and Liechtenstein, where they'll say, well, I have 1,850 patients, and 600 of them are children under 18, and 400 of those 600 still do not test positive Streptococcus mutans.
That's amazing.
And I'm like, God, you need to go to America. And so then I looked at the testing machine. I said, where's the machine? Williams Ivoclar. So then I talked to Ivoclar. I said, how come I haven't heard this machine? He goes, when we marketed that in America, there was 0 interest.
Yeah.
And the only interest
other than the holistic practices who are wanting to do DNA profiling.
I mean, it's just like, so my question is, when do you think earthlings will get religion about communicable disease of the mouth like they already do now with STDs?
I think they are starting to understand it, and the more that we can educate them that if you've got dental disease, it's shortening your lifespan, the more they're going to start getting that. Like, I had a lady come in who's terrified and hadn't been a dentist in 15 years, and her teeth were starting to move. But that wasn't what concerned her. What concerned her is her friend had just had a heart attack. And so she'd been researching about heart disease, and she'd seen all the links about oral health, and that is what got her to come and have her teeth sorted out.
Did you see that book, Ryan, what was the name of that book, Beating the Heart Attack Gene?
Yeah.
Have you seen that book,
No,
Beating
I
the Heart
haven't.
Attack Gene? And this guy's a cardiologist, and I'm sitting here reading this book because I'm going to be 55 next month, and out of nowhere, a chapter is gum disease, and that when you're doing these heart attack cultures, when there's an infection in the pericardial sac, it's only one of 4 bacteria, and the only place they've ever found these 4 bacteria is in gum disease.
And I think this is the thing, is that there's 2 avenues there, isn't there? There's educating the dentists and the dental students and actually teaching them this as they're coming through and in their CE. And then there's also, we've got to teach the medical profession that the mouth is not just something you use to look down the back of the throat. I was talking to a GP friend of mine, and she shared with me how much training they get on the oral cavity. 0. They don't even know what normal looks like. So you get somebody go into the doctor, because this happens a lot here. They'll go to their doctor and they'll go, I've got this lump in my mouth, doc. The doctor looks and they go, I don't know. And they prescribe them antibiotics and tell them they've got to come to the dentist. They come to the dentist and they go, I've got this lump in my mouth. And you go, yeah, you've got one that side as well. That's normal. So can you see how we're on a losing foundation already, because medicine does not see dentistry as part of the body. We're this second rate, we're just tooth fixers. But systemic disease from the mouth is massive. And I think this is where we have an opportunity to educate every patient that comes in one-on-one, educate through blogging, educate through getting on social media, using all those research papers that are coming out, and just every day going, have you seen this? Here's another article that proves that the health of your mouth affects the health of your body, and that those bacteria are not limited to you. You share them every time you kiss somebody. You share them when you're blowing on food. Like, you wouldn't let your dog lick you in the mouth, but you'll let your husband. And your husband's mouth is probably dirtier than the dog's if he hasn't been to the dentist and had regular hygiene maintenance.
I thought the most interesting thing was when they started looking at Streptococcus mutans in the data bank. They tried to say, well, where did this come from? Because most herd diseases, like every STD, came from an animal.
Yep.
And they and then with permutations per 1,000 per the whole 9 yards, they are really great detectives. They say Streptococcus mutans was picked up from a cat 15,000 years ago in the Fertile Crescent.
Yeah.
So this entire disease came to us from a cat, and it's been a parasite living in our mouth. And
it's interesting because around, that time we were starting to move slightly away from being, your hunter-gatherer types. So we were starting to get agriculture, and that's been another big shift, is that the way our diet has changed has meant that we can have that strep mutans, but if you don't feed it what it needs, it won't overgrow and be harmful, because your healthy bacteria are going to keep it in control. But if we're eating a lot of cereal, processed foods, sugars, strep mutans goes, that's it, party time, I'm going to breed, I'm going to take over, I'm going to give you gum disease, and I'm going to give you tooth decay. So there's that double whammy, because you could probably, I've got a very low decay rate. I've only ever had one filling. My mum did not feed us sugar. We were the only kids I grew up in a very poor area. We were the only kids that didn't know what soft drink was.
Where in the UK?
So I'm from Birmingham originally.
Birmingham.
Yeah, so.
I got to tell you my Birmingham story.
It.
First time I lectured in Birmingham, I checked in the hotel and I thought, well, I'm going to go walk around. You can't even make this up. A flock of geese landed. These geese were so big. I mean, every one. You know what I'm talking about? I mean, those were the biggest, and there had to be 1,000 geese at that dental convention hotel. So is that a common scene?
Yes, yeah. I've got video footage of when I was last over in England with my son, and we're out with my brother-in-law feeding the geese bread, and one comes up behind him and bites him right on the backside. It's hilarious. Those things just don't care.
But they're 2 feet tall, aren't they?
They are. They're big. They're quite scary.
They look like flying dogs.
And they'll hiss like mad. But yeah, so we grew up and we didn't have a lot of sugar. We didn't have a soft drink. We had a very sort of meat and 2 veg sort of diet, lots of fresh produce. Now, my mum and dad both had a lot of dental work. My dad had periodontal disease, and we were talking earlier, he died early of a heart attack. So you go figure. But I don't have gum disease, and I have very low decay rate. But I would have the bacteria from my parents. But because those haven't been allowed to progress and grow because of the way I live and the way I feed myself, I am then a product of, showing that you've got to, if you systemically maintain the body, you're not going to get tooth decay.
So I'm wondering, your website, ascendancybusinesscoaching.com, I often wonder when you're working with a client, how much of that work with the client do you almost feel like you're an armchair psychologist?
Oh,
versus,
a lot.
I know.
A lot. I think on a 6-month program, I was, kind of, you just sit down and you work out where you want to take that person, what you want to offer them for that, to give them value for money. And I was like, oh, well, month 1 we'll do this, month 2 we'll do this. We spend 3-4 months mindset and communication and overcoming things like beliefs around money. I had a client recently and I said, well, why are you discounting your work all the time? She says, oh, because money's bad and da-da-da. So we did this whole program around money for her, and we had to break that before she could then case present. Because she says, oh, I can tell them what treatment they need, but I can't talk to them about money. And she had no self-worth either, so she didn't think she was worth charging what she should have been. So, yeah, there's a lot of mindset stuff.
Yeah, I love that Chinese general who said, conquering another army is easy. Conquering the man in the mirror is the hardest thing you'll ever do.
And I'll share some of my journey is that when I hit 34, I spent that whole year wondering what the hell life was about. What's my purpose? Is this all there is to it? Is there more? Is this what I've got to do for the rest of my life? And I started to do some self-reflection, and I realised that I wasn't very good at handling my emotions. I wasn't good at expressing what I wanted or what I needed to be happy. Even to just say, can I have 5 minutes on my own? There were no boundaries in place. And so I started coaching as part of getting some self-development and some personal development, because I thought, well, I'm leading a team, but if I can't do it without having a tanty or losing my temper or getting upset, then this is not healthy. So I worked on myself, and through that I've become a better leader, a better business person. I've become a much better partner and friend. My relationships have blossomed, and I feel really at ease with who I am. I'm comfortable in my own skin. And I think if you can't hit that point in life, you're always going to be missing a part of the puzzle.
Well, Rachel, that's so profound what you said, because so many times I'll be talking to like staff and I'll say, what bothers you the most about your dog? And they go, well, I hate it when he throws instruments. I'm just like, throwing an instrument? I mean, when you're throwing instrument, it's not about that you need a laser or you need a new bonding agent, or So what would you say to someone listening who's throwing instruments and blowing up on their staff?
Well, look, I used to be an instrument thrower. I used to be a blower upper to my staff. I occasionally will still go into that because I'm very driven and I'm passionate about us doing things well. I do get a touch of the Gordon Ramsays from time to time, where I'm like, come on, we've got a job to do. And I go, hang on, who's running the show here? I think we have a perfectionism gene as dentists, and then that gets really honed down to the finest degree. And so if something doesn't go well, we don't know how to handle it. We don't have the ability to step back and put it into perspective. So if you're throwing instruments, you've got to have a look at what's going on with you. What's really underneath that? It's like when a couple argues that someone's put the toilet roll on the wrong way round. It's not really about the toilet roll. There's something that has led to that point. So there's been a trigger that has not been addressed, and that is built and built and built and built and built and built until the toilet roll being the wrong way round is now World War III. Whereas what I've found is, like, I can have a dental nurse, for example, who, I'll just borrow your phone, she'll be holding the composite out here, and I want it here. And so I spend the whole day in my head going, for God's sake, will you bring that composite nearer? But I don't ever say to her, you know what, if you hold it here, it really works for me. So what happens is it's now the 100th time that the composite's out here and I've got to stretch over for it, and you lose it because you've been stewing on it. So for me, it's about being candid, about being honest, and about having those difficult and uncomfortable conversations. And you know what? When you do it, it's never as bad as you thought it was going to be. You're like, you've got a phone call to make and you put it off all day. But all day long you've been thinking about, I've got to call that person, I've got to call that person. And it builds up and builds up. And then you call them and they're actually all right with you. And you go, oh, I should have called him at 8 o'clock this morning and then I wouldn't have worried all day. So I think the advice I'd give is if you have got something that's going on, it's bugging you or you're feeling under pressure, you've got to voice it. And what I learned as a leader is it's not about being the drill sergeant. It's not about having an iron fist. If you can be real and vulnerable with your team, they actually respect you a lot more. I don't mean having a breakdown and crying all over them, although I have done that once in the past when, we have dark days. And sometimes world comes in on you, life's been too much. And then the team are like, oh my God, what's up with Rachel? And they come and they make me a cup of tea and they bought me some flowers and we had a chat. I'm like, they're people. They care about me as much as I care about them. But we have to show that in our business. We've got to take time just to check in and say to someone, when you do that, it really bugs me. Or it doesn't help me with my job.
Last question, because you've been very grateful coming by. We've gone over an hour. You've practiced 8 years in the UK, and now a longer time.
Yes, 17 years now.
17 years in Australia. The UK, they're going through tough times too with the NHS.
Yeah, very.
What are your thoughts about? Are you glad? Would you rather be in Australia with everything going on here, or would you rather be dealing with the NHS?
Shall I be really brutally honest?
Please.
If I had stayed as an NHS dentist, I would have been one of those suicide statistics. I was so burnt out. I was so depressed. I would cry on my way to work. The whole way there, I'd sit in the car, clean my face up, take a big breath, in we go, get through the day, go home and drink myself stupid, because that was the only way I knew how to manage. And I feel that the NHS is just completely ruining doctors and dentists. I had to see between 30 and 40 patients a day. I don't do that many in a week anymore, Howard, to try and make ends meet and to try and generate some business for our practice, because we were getting paid something like $10 for a checkup. So it becomes a treadmill. There is no job satisfaction. There's no opportunity to build a relationship with your patient or with your team. You just go, and you'd numb someone, you'd kick them out, you'd get a checkup in, you'd get that numb patient back in, you'd be like, who was this again? What were we doing? It's a horrible way to work and for very little cash return. And I don't think that 5-6 years in dental school and all that experience and expertise and skill level that we have, that we should be working on a factory fodder kind of output.
So if someone was listening to you in England right now and felt exactly the same way, what advice would you tell them?
Well, you've got the opportunity now more than I did to become a private practice, to set different fees. I don't know whether they still exist, but there were schemes there where you could, like called a DEM plan, where you'd grade your patient's dental health and then they'd pay a premium each month, and that would entitle them to X amount of dentistry each year, and then if they needed a crown or a root canal, they'd pay for that on top. So I would be looking for ways to not be 100% NHS, is to have a mixture of private and capitation scheme patients, so you're not having to rely on that. And look, if you possibly could, and look, I became an NHS dentist because I believe that everyone deserves to have good dental care, whether they can afford it or not. And as altruistic as that was, it was very misguided, because they're not getting good dental care. They're getting compromised dental care. They're getting that'll do because I've run out of time dental care, and that's soul destroying.
And one of the things I don't like about the belief in free dental care for everyone is that they have no incentive to quit drinking Coke and Pepsi and eating potato chips all day instead of bottled water. So if you drink bottled water all day and brush and flush your teeth, and I drink Coca-Cola all day and never brush and flush my teeth, there should be consequences for your behavior.
There needs to be an element of self-responsibility.
Yeah.
Like we've talked about, dental disease is not random. It doesn't just come and pick on an individual. You create an environment that allows you to have dental disease. So if you're drinking, smoking, eating too much sugar, then you've got to realise that there's an outplay. It's like a child. You know, if a child's naughty, they've got to understand there's a consequence for their behaviour. Otherwise, they're just going to keep repeating the same thing and they'll become a juvenile delinquent and end up in prison. So we've got to educate people that what you put in your body is going to have an outcome on your health. I mean, I think the World Health Organization statistics is that 80% of chronic health disease are caused by lifestyle. So why are we investing loads of money in pharmaceuticals when we should be going, guys, healthy lifestyle, stop drinking, stop smoking, get some exercise, maintain your weight.
And what's funny is, in America, they always try to distract, like, right now they're obsessed with opioid addiction.
Yes.
And they keep talking about opioid addiction. I said, really, opioid addiction? How many Americans really know someone that had an opioid addiction or died of opioid addiction when the 3 most common abused drugs are free on every corner? Fast food, cigarettes, and alcohol.
Correct.
And so they're talking about 40,000 died of opioid addiction. How many people died from fast food, smoking, and sugar, which they still advertise Budweiser sponsors every sporting event known to man. Yet I can look at every family that I've known, and someone in that family is an alcoholic causing mayhem. But so it's like they want to focus on opioids. Like, well, why don't you focus on Coca-Cola, cigarettes, and Budweiser on every corner?
Focusing on opioids a really convenient smokescreen. Then, we can take the heat off this, and put it over here, and everyone can be upping arms about, doctors are prescribing drugs and they're getting people addicted, and this is terrible, which it is, and I don't want to trivialise it, but you make a very valid point. So the question is, where's this buy-off then? And there's a part of me that has to say, are we making a lot of money off keeping people sick? And I think the answer is yes, we are.
Yeah.
And so you go, we're taxing cigarettes, we're taxing alcohol, we've got people then having to go and buy lots of pharmaceuticals. It's propping up that whole industry. It's keeping all the doctors, and I've got a lot of doctor friends, so don't go booing and throwing things at the screen. It's keeping a lot of doctors employed. It's keeping a lot of dentists employed. I would rather go, you know what, I've got to hang my drill up because there's nobody who needs me. Everyone's so darn healthy, I don't need to treat them. The only time we should treat someone these days is because they've smashed their teeth in because they've had a car crash or sporting injury, or they've gone over the handlebars on their bike or something.
I think another telling thing about the case for holistic medicine is the top 2 drug advertisements in America are for erectile dysfunction. It's Viagra and Cialis. And you talk to any researcher, they go, when this man cannot... When you're an animal and you can't have sex, you don't want to take a pill. Why can't you have sex? He's got high blood pressure. He's got diabetes. He smokes a pack a day. He's 100 pounds overweight. And you're seeing these people, when they're so sick they can't reproduce and have offspring, taking a pill, and they're in one of the highest mortality rates, people. I mean, when you are so sick as an animal that you can't reproduce and have offspring, you don't need a blue pill. You need to go back and visit your fast food, your alcohol, your cigarettes, your lifestyle.
There was a piece out maybe 18 months ago that said 95% of the world's population is ill. So as a species, we're not doing very well. If we were an animal species and we did not have medication, we are on the brink of extinction. We'd be picked off by the predators because we're not fast enough to run away, and we would not be able to reproduce. We are setting ourselves up for mass extinction, yet we don't see it because medicine, and I am very, very pro-medicine, is helping people to live this illusion that I can smoke, I can drink, I can eat sugar, I can be a couch potato, and I can just take a pill and I don't have to change. But medicine is supplying a demand. We can't, because this is what I see too much of, and it does upset me, is that people will blame the doctors and they'll blame the medical profession for prescribing. And I go, well, hang on, who's asking for those prescriptions? We are. We're the ones demanding. We're the ones saying, yeah, I've had a heart attack, but don't ask me to change. Give me a pill and fix me.
Yeah, and this is brutally rude too, but when you do a general anesthetic and you're under 5 or 12 and you're over 85, it's very dangerous.
Yes.
So in a big country like America with a third of a billion people, if you put tens of thousands of 2-year-olds under for dental work, so every month or two someone doesn't come out of it and they die.
Correct.
And the media it's always the bad doctor.
Yes.
And the last one, it was a pediatric dentist, so a dental degree with a master's degree, and it was a board certified anesthesiologist, and they never go in there and say, well, first of all, Rachel,
it was a 3-year-old child, wasn't it? Yeah.
It's like, why did your 3-year-old need 8 root canals? No one will ever do. It's always the bad doctor, the bad anesthesia, and the family will probably get $1 million reward. And when the reality is, why did your child need 8 root canals?
Why did they have to die for dental procedures that could have been prevented?
Yeah.
Yeah, it's beyond comprehension. It breaks my
Well,
heart.
I'll tell you what. I like your mind. I like the way you think. I always whenever we disagree on something, whether it be water fluoridation or amalgam or whatever, it's like, hey, we both know what we know, but we don't know what we don't know.
And we respect one another.
Yeah,
in that
totally.
And I've always said to anyone who wants to have an opinion, that's fine. Let's not make it personal. Because when it starts to be personal, there's been a line that's been stepped over.
Yeah.
We've gone and we've had very similar education. I was told, just like you, amalgam's safe, water fluoridation works. However, I've then gone, things don't make sense to me, and I do not feel comfortable putting mercury into a human being's body when we know mercury is toxic. So that's a personal choice for me. I think there are better ways to combat and prevent dental disease than putting fluoride in the water and mass medicating everybody. Because, again, Brisbane had fluoride added to the water in 2009, and I lost track of the amount of patients who said to me, oh, that means we can just eat as much sugar as we want.
Well, you know what?
And I'm like, what? No, this is not what fluoride's for.
You know what really opened my mind on the water fluoridation issue is I was looking at Singapore and Tokyo. And Singapore had water fluoridation and Tokyo didn't, and they're similar Asian people, similar Asian diets, and both of their DMTs have been descending for 30 years, and it's 2 advanced civilizations. Tokyo and Singapore are very advanced. Yeah. And when you look at the epidemiologists, they said the water fluoridation is obviously not a factor. It was the raising the dental IQ of the population.
Yeah, and that's been seen in other countries as well.
And what killed me on amalgam, which I finally, it's funny, is so when you look at the ocean from 1950 to 2015, it's gone, the entire ocean, 70% of the planet has gone from 1 part per million to 4 part per million mercury. And they say that's 50% from burning coal. Yeah. From burning coal. And when you burn coal, the smoke goes in the air, so obviously it's going to... But 6% of that is from cremating humans that have amalgams. And my mission now is I'm trying to tell everybody, at least for now, the first thing you got to do, because if we stop placing amalgams today, we're going to be cremating humans for a century.
Yeah, before
so
it's
at
gone.
Least for today, everyone needs to run to their state and local society, because how do you feel sorry for that poor guy working in a crematory? Because he's heating up those fillings till they disintegrate.
Correct.
And when he opens that door, how much atmospheric... so it's like the mercury toxicity he's exposed to is 100 times more than what we're exposed to, and we're dentists drilling this stuff out. But the least thing the humans could do is pass along every city and state that some dentist has got to go into every single human before it's cremated and extract the teeth, and you wouldn't need anesthetic.
Yeah, and they wouldn't complain.
And they wouldn't complain. Might be your favorite patient of the day, the dead man.
I can remember, this must be going back over 10 years because my mum was still living in England, and she sent me a clipping out of the local paper where it was a bit of a spoof, where they were calling, they'd done like a job advertisement for a dentist to come and do that exact thing. But it was to highlight the problem of cremating all these people with their amalgam fillings, and they were calling to have mercury capture devices on the chimney stacks at the crematoria because they'd shown that there was a higher population incident of poor health around the crematoria, and they were linking it back to the mercury from the fillings. So it's been known for a very long time.
And in Arizona, they just tried to, one of the landfills tried to bring in one of those incinerators.
Yeah.
And I was looking at all the protesters, looking at the data. I mean, when you just throw all these cars, batteries, and all this crap in a deal and incinerate it, that puts a lot of
Cadmium, arsenic,
oh
lead,
my
knows
God!
what, yeah,
And I was
all
looking
the
at that,
plastics.
and even though it was 40 miles away for where we live in Phoenix, it was upwind.
But we all know, I mean, if in the UK, if they got sandstorms in the Sahara Desert and then we got rain, it would rain sand from the Sahara Desert. You'd be all over your cars and down the street. It would just be orange everywhere. So we know it gets carried on the wind and within the weather. So, 40 miles away is too close. But I think one of the problems is that dentists go into this very blinkered mindset where it's like, but we've had it for 200 years, we were told it was safe, it saved so many teeth. And I go, yes, but we had carrier pigeon to get messages from A to B and smoke signals, and that worked. But we now have the internet and text messaging and email, and we have to move with the times. We've got to keep up with the modern materials and go, what's going to have the least impact on our patient's environment, our environment in the dental practice, and the bigger picture.
Well, on that note, it was an honor for you to come by and come on the show. Thank
I've
you
really
so
enjoyed
much,
it,
Rachel.
Howard. It's been an absolute pleasure. Thank
So
you.
go to her website. It's ascendancybusinesscoaching.com. Thank you,
you.
Rachel.